Hi, my name is Amanda Hudson, and my class is on Communications 101. I'm doing my project on diabetes, my informative speech. Now there's 4 types of diabetes: prediabetes, type 1, type 2, gestational diabetes, hypoglycemia, and hyperglycemia. Prediabetes, people develop type 2 diabetes almost always before prediabetes. Means blood glucose levels that are higher than normal but not yet high enough to be diagnosed as diabetes. In the United States, who have diabetes is 57 million people. It is a long-term damage to the body and to the heart and the circulatory system. We already occurring during pre-diabetes. To tell you if you have pre-diabetes, there's 2 types of tests that are taken. Fasting plasma glucose test or an oral glucose tolerance test to prevent diabetes by eating healthy, being physically active, and manage your weight periodically. Type 1 diabetes. Type 1 diabetes can be diagnosed in adults and in children. It is previously known as juvenile diabetes. Type 1 means your body does not produce enough insulin. Only 5 to 10% of people with diabetes have this form of disease. There is 23.6 million people in the United States with this. There is medication that can be an important part of a treatment plan. How do you know if you and when you need insulin or other meds? Depends on the person's symptoms and complications you're experiencing by checking your blood glucose daily and keeping a log book. It can help you manage your levels by your log book. So it's very important you have a log book each day. Now there's 2 types of low and high glucose. First of all, the first one is low blood glucose, which is called hypoglycemia, sometimes called insulin reaction. Some symptoms included are sweating, dizziness, shakiness, hunger, and also headaches. A quick way to raise your sugar is to carry a glucose tablets, which are usually at Walmart, Myers, Walgreens, or CVS, any local drugstore. The important thing is to get 15 grams of carbohydrates a day. You can eat 4 saltine crackers, which would bring it up, 4 teaspoons of sugar, or 2 tablespoons of raisins. You can ask a dietitian or a healthcare provider or nurse foods to help you raise your levels. The second type of high blood glucose is called hyperglycemia, which means sugar. The body has too little insulin, or the body can't use insulin properly. Some causes are you ate too much, or you exercise too much, or less. Less. Stress, illness can be a conflict on your body. So when you're sick, it can do a lot of effect to you. Some symptoms also include frequent urination, increase, or even thirst. To lower your blood glucose is exercising, which a key factor is. Check your blood glucose and check your urine ketones. If your ketones in your body are way too high, you cannot exercise because it can make your glucose even be higher. You need to change your diet will also help besides exercising, but both would be also good. Now we're going on to type 2 diabetes. It is the most common form of diabetes. It is very high risk to a person. Body does not produce enough insulin or cells ignores the insulin. Insulin takes the sugar from the blood into the cells, into your body. It can be controlled by weight loss, exercise, meal planning, and diet. Take medication to lower your blood glucose. There is pills and shots to lower the glucose in the body. 20 types of insulin is sold in the United States. Insulin is made up of different types of different insulins, and they all work together. They all work different, and each insulin costs different. The doctor determines what is right for each patient. There is now insulin pumps for patients, which it is a rapid-acting insulin, like using a catheter. It is pumped through your body throughout the day, and when you have eaten a meal. So this is my project on diabetes on my informative speech, and I dedicated this to my mom because she has type 2 and she has an insulin pump, and I dedicated it to Melanie Pankoff, who had insulin type 2. Thank you.